viewers, and welcome to Health Talk on GMC TV. My name is Rebecca Caleb Minor, and today we'll be discussing a very critical issue, a threat to humanity, which is antimicrobial resistance, AMR. Now, imagine a mother rushing her child to the hospital for high fever, and on getting there, the usual antibiotics stopped working. Also, a farmer who is also struggling with his livestock, and the livestock fell sick. He administered, or she administered, the antibiotics he usually gives to the livestock, and the livestock stopped working. Consider farmers, rivers, farmlands and environments polluted with medicines and waste, silently spreading resistant microbes that affect humans, animals and ecosystems. AMR is a growing threat to human health, animal health and environment. But through One Health approach, we can act to protect families, communities and our environments. Joining me to discuss antimicrobial resistance is Dr. Zakaria Mohammed Nafada, Senior Registrar, Internal Medicine, Federal Teaching Hospital, Gombe. Doctor, you're welcome to this program.
You're welcome.
Also, I have Zinatuddin Mohammed, founder of EComed Nexus Foundation. Welcome to this program.
Thank you for having me.
And we also want to congratulate you on your successful Viva Virtual today. And it's safe to say you are now Dr. Mohammed. So you're welcome to this
Thank
program.
you very much.
I'll start with the medical experts. What exactly is AMR? Why is it considered a major threat to public health today?
Okay, thank you. Thank you for this question. Thank you, viewers. Let me start by giving just a scenario that happens in our hospital about 2 months ago of a patient that presented to the accident and emergency with fever and passage of pulse from the urethral catheter that was inserted about 2 months ago on account of obstructive urinary symptoms because of prostate. So this patient presented with fever, and urine sample was taken to the lab, and it was tested. An organism or a germs was isolated as the causative agent for that illness. So, and unfortunately, that germs that was found was resistant to all the available antibiotics that were there. That were available in our own environment. So, and ultimately all effort was made to salvage the life of that individual. However, we unfortunately lost that individual. So that's the critical nature of antimicrobial resistance in our own setting, and it is killing a lot of people all over the world. And in our own setting, more so because of the poor health system that we are having. So by way of just the definition of AMR, at least AMR, we can define AMR as a condition whereby disease-causing organisms called germs or microbes become unresponsive to the regular antimicrobial agent that is being used to treat them usually. So in essence, these microbes could either be bacteria, it could be also viruses, it could be parasite or fungi. So those ones, they are the disease-causing organisms, and we usually treat them with antimicrobials. And specifically, for instance, now for bacterial infection, we use antibiotics to treat them. So AMR, antimicrobial resistance, result when
these antibiotics is no more responsive to the organisms. They are no more responsive to the antibiotics that is used to treat them, and as a result of that, it leads to the progression of the disease, and ultimately it may prolong hospital stay in the patients, and it can lead to a lot of economic burden, because we have to be in the hospital and then to be using a lot of our resources in order to treat those individuals, and lastly, unfortunately, it can even kill the individual, like the case scenario that I just mentioned initially. So this is antimicrobial resistance, and it has been estimated by World Health Organization that is killing a lot of people, estimated to be about 4 point something million annually. That is the recent statistic that is found for antimicrobial resistance. So it's actually a big issue that affects both the humans, the animals, and even the environment, but specifically the humans and then the animal. As I mentioned, that it could affect, it could lead to death of humans and animals also.
Okay, Doctor, tell us why EComed Nexus Foundation is focusing on antimicrobial resistance and why this issue matters now.
Okay, antimicrobial resistance, as earlier stated by Doctor, it is a global health challenge, and it is happening right now. It's not something that has happened or is about to happen, but we call it now the global pandemic, because currently the burden of AMR worldwide is very disturbing. The economic challenges are very also high, and then the death toll attributable to AMR is very high, especially in low and middle income countries where the burden is higher than all other countries. So at EComed Nexus Foundation, we realized a lot of gaps, especially in our communities, hard to reach and low income communities. So there is a need to prevent infections, because if we are able to prevent the infections, then there is no need to take the drugs. So EComed Nexus Foundation, we decided to focus more on trying to prevent these infections directly in the communities by educating them on how they can maintain good hygiene, prevent infections at the household level, not only infections in humans, but also in animals. And then there is a need to make sure that the environment is clean by optimizing our water sanitation and hygiene interventions in those communities. A lot of the infections are waterborne, and if we can have clean water, I think we can reduce the burden of infectious diseases and the need to use drugs.
And like they say, prevention is better than cure. So Nexus Foundation is actually focusing on the preventive measures
aspect.
Okay. Doctor, how does the misuse or overuse of antibiotics in humans contribute to AMR?
Okay, the misuse of antibiotics lead to AMR because misuse of antibiotics tend to cause what we call selective pressure to the microbes, which are the infecting organisms. So it tends to cause a selective pressure on them, and then if these antibiotics are not given appropriately, especially if the dosage is not enough to kill the organisms, or if the antibiotics is not the specific one that can kill the antibiotics, so it's only giving chance for the organisms or the genes to develop resistance. So as a result of that, that misuse of antimicrobials will definitely lead to the will cause will lead to the exposure of a little amount of antimicrobials that is not sensitive to the organism. So as a result of that, they are also wise, the microbes. So they develop a way of a bypass way of living in the presence of the antibiotics. So as a result of that, even if you give it in subsequent individual, it will not work. So, and these organisms, they are also interacting with the environment, they are interacting with with each other, so they can transmit those mechanisms of avoiding antibiotics to the other organisms. So as a result of that, you will see that this misuse in one individual lead to the antimicrobial resistance in almost many individuals that are in the same environment. So, and this misuse of antimicrobial is happening in our own environment, in both humans and animals, and even in the environment, because of the exposure of the environmental waste to the water system and all these things that we interact with. So basically that is how the antimicrobials lead to the misuse of antimicrobials lead to the antimicrobial resistance, which can spread to all over the environment, and the individual that are in the environment can get it, and then from there they can also transmit it to many other individuals in the environment, and subsequently you tend to have the deleterious effect of the antimicrobial resistance in those individuals.
Dr. Mohammed, overuse and underuse. You prescribe 1 tablet per day, I take 2. You tell me to take 3 in a day, I take just 1. What would you say about that?
Okay, indiscriminate use of antimicrobials or misuse is one of the major causes of antimicrobial resistance, and this spans the use in human health, which is the healthcare, the animal health sector. I think we have the highest burden of misuse of antimicrobials in the veterinary and agricultural sector. Then when it comes to the environment, it's not only using antimicrobials, but a key issue is disposal of antimicrobials. Because most of these antimicrobials, when they are disposed in our environments, be it water or in the soil, they interact with microorganisms that are normally not pathogenic, or let me say not harmful, because they don't cause diseases in humans. But by the time they are exposed to antimicrobials, they develop some resistance mechanisms because of the selective pressure in the environment. So subsequently, when they interact with other microorganisms or germs in the environment which are disease causing, they are very generous and they share their genes through a lot of mechanisms. So the pathogenic ones or the disease causing ones will now get the resistance genes, and subsequently when they infect humans, they will become infected with organisms that are already resistant to most of the antimicrobials that are used to treat them in the hospital. So even in the hospitals, for instance, not all hospitals treat their waste before disposing it into the environment. So it is one of the key challenges that we are facing, and to date we don't really have a policy guiding the way we are supposed to dispose antimicrobials in the healthcare setting, in the environment, in homes, and anywhere. So it is one of the areas that we need to look into if we really mean to fight antimicrobial resistance.
You talked about, Doctor, environment, animals. So would you explain how the AMR affects animals and the environment as well? How does it also relate to human beings?
Okay, antimicrobial resistance in animals and environment. Usually, as we said, we consider one concept called One Health, of which we look at the health of humans, animals, and then the environment, because we are all in both humans and animals are in the same environment. So and we interact with this environment, we interact with each other, human and animal. So through our interaction, human to animal interaction, those disease causing organisms that have acquired resistance from exposure, either misuse or exposure to antibiotics unnecessarily in the veterinary setting, they can if we are interacting with those humans, we can acquire those organisms or disease causing germs from those animals, which can transmit to humans, and from the humans we also excrete our waste product into the environment. So it will be like a vicious cycle of from humans, from animal to humans to environment, and from environment to animal to human, or directly to humans, and then the cycle will just continue. So just like how she also explained that these organisms, they are generous, they can share their genetic makeup, they can share the memories they got of exposure of antibiotic from either the environment or the animals, the animal kingdom. So it's important we realize the interaction between the three entity, and also address the antimicrobial resistance and those three entities as we are doing.
Dr. Mohammed, would you want to explain more on that?
Yes, Doctor has already said most of the things, but I would like to add that antimicrobial resistance can be transmitted through food also. And that is where the agricultural sector comes in. For instance, animals and humans excrete a lot of pathogenic organisms into the environment, but we get manure from animals, from animal waste. So sometimes we can use those manure in farms. Some already contain microorganisms that are already harboring resistance genes. So along the food chain, if there is no proper hygiene, and there are some vegetables and fruits that we take without really cooking. So if we don't wash them, we don't maintain proper food hygiene, then there is a chance that we can get infected with these resistant microorganisms. And there is also the issue of withdrawal period, where when you treat an animal, you are supposed to stay for some time before using that animal for meat, milk, or any food product. But most of the farmers, take for instance poultry, most of them, they are giving them antibiotics as growth promoters for them to grow very well for their economic gain. But mostly they can treat animals today and still sell them today for food. So we take those antibiotics as residues in the animal tissue, even in eggs. So we expose ourselves to lower doses of these antimicrobials, and the organisms that are infecting us become resistant to these drugs because they have already exposed them. We have already exposed them to a lower dose of that drug in our system, making them resistant to it. They are already used to it. It's just like, for instance, mosquito in our houses. You can flit now, and the next moment, mosquito is still moving in your house. They are already used to most of the insecticides. So it's a similar scenario.
You were in some communities in Gombe. Yes. What are the common practices that accelerate the spread of resistant infections in Gombe specifically? Yes.
So from our work with communities in Gombe metropolis, we discovered that the number one issue is the issue of hygiene, especially wastewater. Most of the houses have pits at the back of their houses where they discharge all wastewater, some even water from the toilets. So when these pits fill up, they tell sometimes even kids to pack the waste without proper barrier or gloves. They pack the waste directly and dispose it on the streets. And in these streets, we have our animals, our children, and even adults moving around. So through that process, we can still cycle back some of the germs that are in that wastewater to our homes. And secondly, even solid waste disposal. Not all communities have a designated place for waste disposal. And even if they have, that waste fills up and overflows, and no one is taking care of it. So we have a lot of chances to transmit infections through these processes. And most importantly, attitudes, because we did a study on knowledge, attitude, and practice, but we discovered that in all the communities we studied, none had a good attitude towards prevention of the transmission of infectious diseases. And this is quite worrisome, because it means that most of the infections we are taking to the hospitals are from the communities, and we have a likely chance of taking multi-drug resistant infections or resistant microorganisms to the hospitals, and also spreading within our homes and communities.
Doctor, in the course of your presentation at earlier you gave us a scenario of a patient you lost at the A&E. So how is AMR affecting treatment outcomes, especially in hospitals and rural communities?
Okay, that's a very good question. Actually, looking at the human health sector, the antimicrobial resistance affects the treatment outcome a lot, in the sense that, as I rightly mentioned, it can lead to increased morbidity and mortality in those individuals that got infected with multi-drug resistant organisms, and it increased the hospital stay. It also increased the economic burden on the patients and patient relatives, because they have to buy a very expensive antibiotics. Sometimes we have to even send the patients to get antibiotics from even abroad, just to treat a multi-drug resistant organism. So you can see that antimicrobial resistance is impacting so much on the patient and patient relative alike, and we are all in this issue. Nobody is immune to getting infected, because we are living in an environment that has a lot of microorganisms. Even now we are talking here, we have some microorganisms that are suspended in the environment. So we are not immune to them. Even if we feel we are immunocompetent, sometimes a lot of things can happen, and then we have also vulnerable people in the environment, in our environment, especially the children, the elderly individual, and then the pregnant people, the pregnant women. They are one of the vulnerable patients, and once they get infected with multi-drug resistant organism, the outcome is very bad, and usually some of them even end up dying from those multi-drug resistant organisms. So in essence, this antimicrobial resistance impacts so much on the treatment outcome in both in all healthcare setting, be it a tertiary healthcare setting, secondary healthcare setting, or primary healthcare setting, and a lot has to be done in order to curtail these things. And of importance is that this healthcare associated infection, individual can enter into the hospital without any infection for one reason or the other, but he can get infected with a multi-drug resistant organism which are already thriving in the hospital. So a lot has to be done in the aspect of infection prevention and control, even in the healthcare setting. So we need everybody's hands in order to address this issue of antimicrobial resistance, be it from the community, from the all the healthcare personnel need to be involved in this fight against antimicrobial resistance, because it's a problem that affects everybody, and nobody is immune from getting infected from any organisms. We are all in this problem together.
Doctor, there is this practice I observe people do when they are sick. They just go to the hospital, or they don't even go to the hospital. They go to chemists or just the markets and then this thing worked. This antibiotic worked for me the other day. After all, the doctor prescribed last year and it worked. So you see people just go into my markets or chemist to buy and drug, and when they take 1, 2, 3 days, they feel okay, they stop, and then they also share. Is that also fueling AMR?
Yes, that is part of the misuse and overuse of antimicrobial in our own setting. And unfortunately, in our own setting, many people just take antibiotic for granted because whenever they feel sick, they feel like because of the healthcare setting that we have, there is no control of prescription and then selling of antibiotics in the pharmacy, patent medicine stores. So they feel like they will just walk into the pharmacy store and then ask for antibiotics. And once they ask for antibiotics, they can get it. And in fact, sometimes they even suggest to the pharmacist which antibiotics they want, and ultimately they will get it and then they will use it the way they want it. So that's the danger of getting it from somebody that not from healthcare setting, because sometimes even if they tell you what to do with the medications, maybe you will not follow it, because you feel like you just walk into this thing, into the pharmacy store, and then you collected this medication and you are using it. Maybe you will use it for 1 or 2 days and then stop. So you are exposing this disease causing germs in your body with low dose of antibiotics. So you are allowing them chance to learn the mechanism of action of those antibiotics and develop resistance, and as a result of that we will have antimicrobial resistance. So that is for one aspect. And the other aspect is that somebody will feel like, okay, I took this medication, a doctor gave me, and I took it, it's working for me. So as a result of that, you are also having the same thing that I'm feeling. So I will just complete this antibiotics. It's also dangerous, and it's expose the disease-causing microbes with low level of antibiotics, because ultimately you are not going to get enough antibiotic in the system to clear those infections. So another bad practice is that we notice people usually will walk into the patent medicine stores and then just ask for antibiotics for 20 naira, 30 naira, 15 naira, and just to cut it for them. So this is to tell you that they are not going to take optimal dose, and as a result of that is a misuse. So these are the things that are spoiling antimicrobial resistance, especially in our own environment, in human sector. And this, if you look at the animal sector, is even worse. Sometimes it's not even the pharmacy store that will suggest anything. A farmer will just feel like these antibiotics can be used for growth promotion in my domestic animal, either cows or goat or even poultry. They will just buy it and then keep on giving those animals. The danger of it is that it will lead to the development of antimicrobial resistance in those animals, which can lead to their death. And then it's also expose those individual humans that takes meat from those animals also with soft therapeutic doses of antimicrobials, and as a result of that will foil the antimicrobial resistance. So this is just a vicious cycle, and everybody has to be careful. This is a big problem. It's a pandemic, is a global thing, and it's going to consume us if care is not taken. So we have to look at our attitude to stop taking all those things. If you feel like you are sick, you should go to the hospital. A test will be run, and then you can confirmation will be found for the infection that is wrong with you, and then specific antibiotics will be given. There are common practices, like if somebody is having cough, or catarrh, we just take antibiotics, let's say augmentin. So it has been found that because it has been found that many of these common cold or catarrh is caused by viruses, not bacteria. So there is no need of taking even antibiotics to treat it. Whether you take antibiotic or not, in 5 days or to 10 days, individual with catarrh the catarrh will clear up. So there is no any need of taking antibiotics in order to clear that catarrh. Another thing is that somebody will have malaria and then will feel like he is having also typhoid without any specific test in the healthcare setting. Then he will also combine anti-malaria and then antibiotics, which will also spoil the antimicrobial resistance in our own setting. These are all bad practices, and people, we should be conscious of all those bad practices in order to correct it. We are all in this problem, and it's going to affect everybody if care is not taken. So we should also be careful with what we do.
Dr. Mohammed, you've worked in the community, as I said earlier on. Yes. What are the common myths that people associate with AMR?
Okay, some of the things we discovered while working in the community was that most of them feel if they have taken drugs and these drugs do not work. There is a lady that told me that she has been taking drugs. At first she was buying from the patent medicine store, but she later went to the hospital, and her wound, she showed me a wound on her hand. It has taken over 2 years. So she said maybe her village people are following her, and that is why the drugs are not working. She even told me that her father has already told her not to go to the hospital again, because as she is going to the hospital, her village people will still be following her. So it is one of the myths we discovered. And then most of them don't even believe that wastewater or waste can transmit infections. They were asking us how the bacteria or the germ will jump from wastewater into their hands or into their food. When we were demonstrating hand washing, so it took a lot of time. We used 12 weeks of weekly engagements, giving them scenarios and reasons why they should change their behavior. So actually we had to use a social science approach, basically focusing on behavior change, because they will really not understand the science. There are a lot of myths, and then traditional medicine sellers are always telling them negative things about antimicrobials. So once they have an infection that is not being able to be treated because they are not using the right drugs prescribed by the healthcare professional, then they will have a lot of myths around why the infection is happening and why they are in the conditions that they are.
Our viewers, if you are just tuning in to GMC TV, we are on Health Talk, and today we are discussing antimicrobial resistance. And we've heard from the expert, it is a global threat. It affects humans, it affects animals, it affects the environment. And many is because of human behavior. We take drugs without doctor's prescription, or if we take as the doctor prescribes, we do not complete it. And it has led to many illnesses that cannot be treated because the antibiotics are now used, disease is now used to the antibiotics, and so it's therefore not curing our disease. We'll go on a commercial break, and when we return, we will continue with the program. Stay tuned to Health Talk on GMC TV.
Do you know you can flow in a life of happiness if you reset the thread you unknowingly shut in motion?
Every time you abuse the correct use of prescription, you are causing resistance of test and see a doctor. Don't misuse your medication to enjoy your life of freedom. Make sure to use the right dose and at the right time for a prescription. That way your treatment is right, as you will complete completion. He's an arrow and a threat to humanity. AMR is a danger and a threat to everything. AMR is an arrow and a threat to humanity. AMR is a danger and a threat to everything. So there's a way, if we change, we can make our future great. We can stop the resistance and make the world a safer place.
How do you think your body feels whenever you never complete it? First step, you see a doctor. Next step, you get prescription. Use it, don't stop till it's finished.
Use it, don't stop till it's finished.
1, 2,
Go to the doctor,
3, 4,
get your prescription,
5, 6,
get your medicine,
7, 8,
take your medicine,
9, 10.
finish your day. Use it, don't stop till it's finished. AMR is an arrow and a threat to humanity. AMR is a danger and a threat to everything. AMR is an arrow and a threat to humanity. AMR is a danger and a threat to
AMR is a threat to humanity, and it needs a collaborative effort to address it, and that's why the One Health approach is being propagated. So we talk to you, Dr. Mohammed. Your organization promotes One Health approach. How does this approach help in tackling antimicrobial resistance?
Yes, One Health approach is the best way to tackle not only antimicrobial resistance but all infectious diseases. One Health is basically tackling infectious diseases and also antimicrobial resistance from all angles that are being affected, and these include the humans in the human health, animal health, and the environment. And recently there is an addition, which is the plant health. So plant health is now included as one of the key components in One Health framework. And this is because some of these infections are food-borne infections, which we can get through food animals or food crops. So the One Health approach basically integrates interventions that cut across all these domains. Because if we are doing interventions in silos, that means we can take care of infections in one domain, be it animal, human, or the environment, but the other domains remain infected or remain with challenges in infectious diseases or antimicrobial resistance. And because we are living in one environment, that intervention will definitely be lost at a time, and the infections will now come back to the other domain. So any intervention we are going to do is good. We take the One Health concept, implementing it in the human sector, animal health sector, and agriculture at the same time, so that we can have maximum impact.
Doctor, what role do agriculture, health, veterinary service, environment management play in preventing AMR?
The agricultural sector actually significantly contribute to the burden of AMR because even if you look at the tons, the amount of antibiotics that is used in animals is huge compared to what is being used in humans. So about more than 50% of the antibiotics, or even 70%, are used in the agricultural sector, be it in the human husbandry aspect or the crops, the plant aspect. So the agricultural sector contribute immensely to the burden of AMR, and I think a lot has to be done in that aspect. I know there are a lot of existing policies guiding the practices, veterinary practices. However, from the community aspect, we also need to do much in the community aspect, because this dysregulation in buying there is no any regulation in buying any of these antibiotics that can be used in the agricultural sector. So as a result of that, individual in the community feels like they can just buy those antibiotics and use it directly, which will contribute immensely to the development and maintenance of antimicrobial resistance in our own setting. So a lot has to be done on the agricultural sector. Actually,
Dr. Mohammed, what behavior need to change at the community level to reduce misuse of microbials?
Okay, I think at the community level, the best we can do, I think, is continuous engagement with them, showing them the need to refrain from using antibiotics without prescription, and also the need to even prevent the infections from happening in the first place. Because I don't think anyone will even be happy spending money on buying drugs if there is a way he can prevent being infected in the first place. So I think that will go a long way. So I think we should focus more on behavior change and also educational programs that will teach communities how to prevent infections, and also the need to stop indiscriminate use and use of antimicrobials.
Okay, how can traditional rulers and religious leaders support this fight?
Yes, I think they are the main stakeholders that can help us fight against AMR at the community level, because most of the communities are answerable to their leaders. In our settings, whatever our community leader or a religious leader tells us, we really follow those instructions. Yes. So especially the religious leaders, because we go for worships, be it Sundays, Fridays, or our routine prayers that we normally go. So I think they have a key role to play when they tell the communities how they can prevent themselves from being infected, or the need for them to stop buying drugs indiscriminately. I think that message will be more appreciated by the community than just healthcare workers going to tell them most of the things that they do not actually believe.
Doctor, do we have enough policies, regulations guiding the sales and use of antibiotics in Nigeria? If we do, how effective is that policy?
Actually, selling of antibiotics in Nigeria, from the literature and from what we gathered, we have regulations. However, these regulations are not being imposed so much on the system, and as a result of that, we are left with a system that antibiotics are being sold by anybody that just feel he want to make profit. There is one research that we did. We found out that 95% of the patent medicine stores, they stock antimicrobials, and then they sell the antimicrobials, and the reasons why they do that usually is because they want to make profit. So basically we are looking at if you look at from the business point of view, they are just selling the antibiotics to make profit. So most of them doesn't even know that the resistance exists, and then this is the danger that will happen if they keep on selling antibiotics without regulation. And we know that most of them know that they don't even supposed to stock antibiotics in their shops. So and that even presented a challenge when we were taking administering questionnaires, because they thought we are coming from the Pharmaceutical Council of Nigeria, because they usually visit there and then stop them from selling stocking and then selling antibiotics, because they are not supposed to stop them, especially for those patent medicine vendors, not for medicine stores that are registered to sell antimicrobials. So I think the regulation exists, however it's not being enforced so much to the extent that we will achieve environment free from selling antibiotics. The regulations exist. So, and also if you look at the policy, after the World Health Organization action plan and then the directives that they gave in around 2016, so each country were mandated to produce their own national action plan. So, and Nigeria also, we produce our own action plan guided by the Nigerian Center for Disease Control 1.0 in 2017. And key component of the action plan include the surveillance, providing regulations and then educations, and also training and recruitment of healthcare personnel. So in that guidelines, action plan, it works to some extent. However, there were a lot of challenges, so they have to revise the national action plan in 2014, last year, and now we have the national action plan 2.0. that's the recent one, and there they also provided the financing of how you can finance all these policies so that it can be carried out, and other things. And if we look at the World Health Organization, they launched their Sentinel surveillance application, and they included many of these tertiary hospitals. Like in our Federal Teaching Hospital, we are registered with them, and then most of this antimicrobial susceptibility testing, like in those organisms, when we find it, we register, we upload to the national guideline, national database, and from there it's going to be transmitted to the World Health Organization, and they are really using those information in trying to guide the policy, to refine the policy, and also provide guidelines for specific infections, especially in regions, in places where you cannot carry out the tests to find out whether this infection is resistant or is not resistant. Like in remote setting, in hospitals that are in the villages, usually we rely so much on the guidelines that is being provided by either the National Center for Disease Control, the World Health Organization, or professional bodies or other professional bodies. So that is what is happening actually as regard to the guidelines, regulations and policies as regard to antimicrobial resistance.
Okay, Dr. Mohammed, what long-term measures should government and stakeholders prioritize at this time?
Okay, I think it's high time we prioritize the One Health approach in tackling antimicrobial resistance, because this will give us opportunities. Take for instance, one aspect of the National Action Plan is surveillance. We are doing surveillance in the healthcare setting. We are doing it in the veterinary sector. However, there is no structure for surveillance in the environment. One key component of the environment is wastewater, and we have been doing surveillance on poliovirus, which has helped us to track and move towards elimination of poliovirus. So I think it is one of the components that WHO is currently highlighting. There is a need for wastewater surveillance, because that will even give us the picture of how AMR is transmitting in the environment, and we can even detect a lot of outbreaks of infectious diseases before they even occur in the environment or in the healthcare sector. So I think there is need to focus more on the environment in all the interventions that we are going to design going forward.
It's antimicrobial week, and I know EComed Nexus Foundation has engaged in so many activities to create awareness. So what more do we expect?
Yes, EComed Nexus flagged off the Antimicrobial Awareness Week since from last week, looking at the lineup of activities that we have. So we started by visiting secondary schools, and 3 secondary schools were visited. In those secondary schools, we carried out a robust awareness and also teaching them, because it's not only being aware, but we taught them how they can prevent themselves from infections. So most of the secondary schools had some competitions, and they did very well. We were amazed at how secondary school students could picture how AMR is affecting the community, and even after the lectures they could draw how microorganisms can become superbugs. So we also had some engagements in markets, mega parks, and also in households. I think the household engagement held at Kagarawal community, where we were able to visit 120 households and engage them one-on-one on antimicrobial resistance and the way they can prevent it.
So as you wrap up, Doctor, your strongest message to the public on stopping AMR?
Okay, antimicrobial resistance is a public health emergency, is a public health is a condition that poses a lot of challenges to the public health. So the public should also do their own part in trying to stop, reduce the consumption of misuse of antimicrobials by reducing self-treatment, and also presenting to the health facilities for specific tests to find out what really is wrong with them. And we should also avoid sharing antibiotics and then stopping with antibiotics treatment without completing the dose, because that contribute immensely to the development of antimicrobial resistance, and from there it tend to transmit to every part of our environment, and we are in serious problems when it's get into our vulnerable population, especially pregnant women, the children, and then elderly individual, which can lead to their death.
Okay, Doctor, your final word.
Okay, so finally, I would like to call all individuals from whatever sector we are, be it community members, healthcare workers, government parastatals, hospitals, even the media. We are all in this together, and we have to work together, act now against AMR.
Thank you so much. Viewers, as we wrap up today's program, remember, AMR is a threat spreading through our homes, farms, and environments. Misusing antibiotics or disposing medicines wrongly pushes us to closer infections and cannot be treated. But we have the power to act by using medicines wisely, protecting our animals, and keeping our environment clean. We can slow the spread of AMR. The fight belongs to all of us, for the health of our children, for the health of our parents, for the health of our community. Thank you, our guests, for coming to this program, and thank you for the insightful contributions.
Thank you for having us.
Well, viewers, this is Health Talk on GMC TV. Stay tuned, stay responsible, and be wise. Thank you.
Do you know you can flow in a life of happiness if you reset the thread you unknowingly shut in motion?
Every time you're abused,